Hi everyone, welcome to episode 4 of season 2 of the Sparked podcast. This is touching on nursing, as we know, is an integral part of the health system, but not all nursing is the same. So we want to explore how Spark benefits the profession across the full range of the nursing scope. My guests are Jeanette Gogler. Jeanette is the Deputy Chief Nursing and Midwifery Information Officer at Monash Health and the Australian College of Nursing Rep at Sparked as the Chair of Nursing Informatics and Digital Health Faculty. She combines her years of varied clinical experience, education and health informatics to provide a pragmatic approach to digital health. Jeanette has extensive experience in health informatics and is currently focused on nursing documentation with coded concepts. Zara Lord is the CEO and founder of UPaged, a nursing workforce talent platform that connects nurses to on-demand work. Zara is also a registered nurse specialised in intensive care. And finally, Karen Booth, who is the Chief Clinical Advisor Nursing for the Australian Digital Health Agency and is the President of the Australian Primary Health Care Nurses Association, APNA. She's worked as a primary health care nurse and manager in general practice since 1998, which has included acute and preventive healthcare, chronic disease management, care coordination, data management, accreditation, administration, staff training and mentoring, just a little splash of nursing roles there. So, to our questions, nursing is such a diverse workforce, primary, community, acute care, and it's obviously very data document heavy. To you first, Jeanette, can you tell us what areas you're working in and what are the key opportunities that Sparked and the standardisation of data that it provides to the nursing community?
I've worked with nursing data for a long time, so I probably have an interesting perspective. Monash Health is a huge health service, 8 hospitals, very large community network as well. When you start to look at nursing data, I think different aspects of nursing, whether you're working in the community, is really a subset of the whole lot of nursing data. I've been working in this space for a long time, looking at nursing documentation and the types of data that we actually collect. By using some standardised nursing concepts, we'll be able to share that data across the continuum of care. That's really important for the patients. It's not just beneficial to the nursing profession, it's also what that means for the patient as part of their continuity of care. What Sparked is going to be doing really is driving the work that we're currently started around standardised nursing terminology a lot faster so that we can keep up with Sparked. And I'm happy to talk about that work and what we're doing a little bit later.
Terrific, thank you. And Zara, tell me what that drive to standardisation through Sparked means for you.
A lot of it's raising the profile of nursing, being able to have nursing visible in the records. And it's been the work that I've done with Jeanette through the Australian College of Nursing that's become really apparent to me. On the other side of things, I'm a registered nurse working in intensive care, entering data in these systems and wondering what's happening with it. And I go between a lot of different hospitals, use a lot of different systems, and I see different ways that these systems are configured and then wondering what that means for the data at the other end of it. This work is important to me to know that what I'm entering in is being able to be used not just at that organisation, but on a national and potentially even global level.
Maybe with a slight suspicion at the moment that all that data that you're entering isn't being used to its full capacity and capability.
Yeah, it's becoming very apparent to me.
Terrific. And Karen, data standardisation, what does it mean to you?
Standardisation is really important. And I've spent the last couple of decades working in general practice, helping set up disease registers and teaching nurses and doctors how to use their data to actually track their patients and do interesting things like set up clinics, particularly for chronic disease, so they can better manage patients. But one of the big issues in particular has been things like systems that don't talk to each other, and then looking at how we much more efficiently use data. One of the really exciting things happening at the moment is that the nurses' registration and competency standards are all being reviewed at the moment. And we have this really good opportunity to look at how we're building nursing standards around digital capability. And of course, then the work that you're doing in Sparked can then also be built into those practice standards that we're trying to put together for a very future-focused workforce. And that digital health is business as usual. So to me, they're the most important things.
Terrific. And Jeanette, you work in Monash Health in a leadership role, CNIO. What does that mean to you in terms of driving this digital transformation?
And I think these roles are really important because it gives credibility to the leadership in making changes within the organisation. I'm very fortunate to have been working in nursing informatics and these kind of roles for over 30 years. And more recently, Monash Health is actually leading some work around standardised nursing terminology along with the Australian College of Nursing, as Zara mentioned, and the Australian Catholic University. We're currently entering the standardised nursing terminology to the nursing care plans within Monash Health. So we're just starting on that journey, and my vision would be that we can coordinate that across the country. And through our network we have with the Australian College of Nursing, we're very passionate that assists with the sharing of information going forward and the use of FHIR in order to be able to have nursing data driven through that messaging in order to be able to follow the patient as part of their journey. When I heard Karen talking about her work, I thought we have to make that paradigm change from working on paper to actually thinking that we're going to be working in digital systems, and we will have a lot more structured data in a way that we haven't had before. And the nursing and midwifery capability framework will help nurses in being able to understand the depth and breadth of digital health in order to be able to drive some of that change. So we still have a long way to go. It's very exciting, the work that's happening in Sparked, but there's a lot of work at the professional level that we still need to be able to drive so that we get that excellence going forward.
Thank you. And Karen, primary care has such a central place in data exchange. What about your role as a primary care nurse?
I just spent the last 2 days working in general practice, hopping in and out of people's My Health records. That information in there is absolutely crucial, particularly when people can't talk to each other or systems don't talk to each other. I had to do a welfare check on a little lady yesterday who hadn't turned up for a couple of medical appointments. She lives alone, and it took me more than half an hour to track down through her contacts to eventually find actually she'd been admitted to hospital, but there was no message from the hospital to talk to our system to let me know where this lady was. I was one phone call off 000 to go and do a welfare check on her. So making sure that, one, we've got systems that talk to each other. All of those things, particularly that Janet said, the language where it's understandable between systems, that it's consistent, and we can streamline processes with digital management. It'll give us more time for patient care, improving health outcomes, but also contributing to that big picture. A few keyboard strokes away and you've got the big picture of health for that person once everything's talking to each other. For me, that's really exciting, particularly for primary care, where sometimes you're out of the loop. It will help bring us in and I think help to focus more on that big picture view.
Terrific. We shouldn't forget that scenario you played to us just now, they're real stories, and they're probably happening scores and scores of times across Australia every single day. And it's a real tragedy that it's preventable with, as you say, the kind of data interoperability that we're seeking to achieve. Zara, from a tech startup perspective, why is it so important for earlier stage and private companies such as tech startups to ensure their data aligns with the national standard?
It's really important to start out as we intend to go on. In the short term, data standardisation with the national standard shows credibility. It shows to larger organisations that you're thinking long term. As your system evolves, it can mean less bugs because you've got uniformity in your data, especially as different inputs over to different front-end changes can occur. You've got the standardisation in your back end to ensure that it's always going to find the data you're looking for. It also prompts an all-important look at your data, how it's stored, the format, and it gets you to ask the question of how you want your data to be used in the long term. At the end of the day, your data is your intellectual property. It's an asset. It needs to be in a usable format to impact change. And then the more obvious things are that it opens up the door for interoperability. And in this world of modern healthcare and digitization, larger organizations are going to want systems to interoperate and communicate with each other. And that's how we can achieve the most impact and scale.
Well said. No, the bus is leaving the station. We all want to get on it, right? Karen, in your role in the agency, what's your perspective on what the Australian Digital Health Agency is currently playing in terms of bringing standardised data to nursing?
There's a lot of work happening where we're looking at providing clinical expertise. So we've got a lot of clinicians involved in Spark supporting that, but also in programs within the agency to make sure that we've got consistency in the type of work that we're doing and that it links up with Spark. Knowing the importance lies in those digital standards that are being formulated through Spark, and making sure, again, that flows through the different areas of the agency, and that will guide us to provide the best possible care, making sure that our team is informed of the work that's happening. And for my role as a nurse, it's getting that message out there, getting messages about why we need standards, how they will apply to policy and decision making for nurses in primary care where I work, but also across the board. For us, they're the most important things. And as previously mentioned, making sure that language is standard so everybody understands what everybody else is saying or meaning in their communication.
Thank you.
And now it's time for a fun fact from Kate.
Sparked is making its way around Australia to ensure specifications are fit for purpose for all Australians. We're looking forward to visiting the remaining two, ACT and Tasmania. To date, 18,000 in-kind expert hours have been delivered by the Sparked community.
And you've all been involved in Sparked events, and through that involvement in the development of nursing terminology, what do you see as the value in being in the room as a rep for all of those various nursing paths? Karen, can I go to you again?
Yeah, sure. Look, I think it's really important to have nurses there because they do bring a different perspective. And whether it be a medical perspective, allied health, nursing perspective, we all come at it something from a different angle. And that's one of the really fruitful things about having multidisciplinary people in the room. And of course, you've got the vendors who need to understand what the needs are for clinicians and for health professionals, but also the consumers in the room to make sure that they can understand what we're talking about too, because ultimately people will be able to use their own health data to manage their health better. And making sure that everyone knows what everyone else is talking about, that it's pertinent to them, I think will also then help to guide people's understanding of why things like standards and language are really important.
And Zara, you'd be in the room, but not just with an ICU hat on. How do you find that role?
I feel so strongly, Brett, that if we're not in the room representing nursing, people will make decisions for us. And it's really important that we are advocating for the systems and the processes that we want to use and how that data is going to impact change. Because at the end of the day, nurses know patient needs in a way unlike anybody else. And unless that's being collected and used in a meaningful format, other people are going to make the decisions for us. I did a Waterloo score on a healthy 26-year-old male the other day, and it was 93 clicks to enter the data. We need to be valuing nurses' time. And I know that's a front-end issue, but by being in the room, talking about things that are important to nurses, we can impact that change at a much more national level. And we have the opportunity to voice these concerns and look at what perhaps a nationally standardised care plan can do. We've got a big job ahead of us. It's really important that we're in there speaking up for things that's taking us away from patient care.
Fantastic. Jeanette, do you feel seen in the room as you're advocating and inputting?
Yes, absolutely. And I've been very fortunate to even present at Sparked around nursing interventions for chronic disease management. And it was fascinating, actually, after I presented, the technical people spoke to me and said they had no idea that nursing was so in-depth. It's often that nurses are the ones who are the advocate for the patient. It's so important that nurses are included in these national innovations. But standardised nursing terminology is fascinating, really, because nurses have had standardised nursing terminology for over 30 years, and there are many standardised nursing terminologies in use. Australia hasn't adopted that, but we're just on the journey. So this is kind of like a two-pronged event. We've got the initiative of what Sparked is doing with FHIR, and that will really help with a lot of our assessment data. But then there's also the work where we're looking at applying the International Council of Nursing standardised nursing terminology, which has been mapped to SNOMED pretty much completely, but we're still working on that. And so we're looking at that within the Australian context and then wanting to be able to share this nationally. And we're doing this work through the Australian College of Nursing and also with ADHA, who are very interested in the progress and the work that we're doing in this space. And we've set up a research and development centre with the Australian College of Nursing, Monash Health and the Australian Catholic University. Because if we're going to be implementing standardised nursing terminologies for the nursing and midwifery profession, we also have to have a better understanding of what that is and what that means. And it needs to be part of curriculums and so on and so forth going forward. So it's more than just saying, well, we're going to be messaging and we're going to be using FHIR and Sparked. We have to get sort of under the hood a lot more and have better knowledge at that ground level around what that means. Because if we're not careful, nurses always find another way of working around a system. So we need to get the message across as to why we're using a specific expression from that nursing concept and the fact at the back end that that's actually coded and then that code is actually going to be shared. And that's really important. We've got nurses who work in remote Aboriginal communities. We're not all just working in urban environments. And so there's a big reach that we need to be able to make as part of this.
That SNOMED work, the standardised nomenclature in medicine, what do you think the opportunities are there in having that implemented?
At Monash Health, we've recently just coded the standardised nursing terminology. We've put in the SNOMED codes for the nursing care plan. So we've made a start on this journey and we're about to perform some research. By having these standardised terminologies that are used in nursing mapped to SNOMED, of course, that enables that interoperability going forward. There are still some gaps, which is the work that we're currently doing. So we have expressions perhaps in Australia that the other countries don't have. And apart from that, medicine is changing and there's different descriptors that we need to make sure that we're on top of. So there'll be a process of applying for a code that will help us in the future. SNOMED will be the default standardised terminology system, but we just need to make sure that it adequately covers what nursing requires. And there are other standardised opportunities too around things like LOINC that will be able to capture a lot more of the data around vital signs and pathology and specific discrete data. So that not everything's going to fit into SNOMED, I guess is what I'm saying. So we need to look at how that actually is going to work in terms of being able to provide a picture around the patients with that sharing of the data through their continuity of care process.
Terrific. So yes, covering the clinical terminology, but also all of the adjacent nomenclature that supports that. Karen, can I ask you, what about clinical governance in the Sparked program? How important is that?
Very important. But just before I jump there, one thing I'd like to add to Janet's comment about nurses or do the workaround. I worked with a medical colleague who said there is nothing that you can make that is childproof or nurse-proof. And that's true. And I think what we really need to concentrate on is making sure that we're all coming or reading from the one page, that we're all coming at this at the same time. Clinical governance is really important in that we want to make sure that while something might look amazing to health professionals and think, wow, I can nail this, this is great, what's the effect with the patients? So making sure that everything we do, every program has a clinical lens over it that's looking at, is this really workable for health professionals and is it safe for patients? And that we can then build trust. And part of what the agency does is trust building in digital health, letting people know that actually your safety is our ultimate goal. And then, of course, the other issues with clinical governance will be all of those things that help patients to not have to retell their stories, to make them feel comfortable, to make them feel as though actually we're part of the journey with them. They're really key issues.
Thank you. And then a question for everyone. What does sparked success mean for all of you? Can I start with you, Zara?
It's giving early stage companies and private tech companies an opportunity to play with the big players, an opportunity to interoperate and be a part of the biggest solution in the Australian healthcare system. And I'm a bit of a broken record when I'm speaking to, I mentor on a few startup groups, and when people haven't heard of Sparked and the data standard and the national data set, I'm like, you need to be a part of this, show up, be in the room, learn about what it's all about, because I think the more people are aware that this exists, the more they can get support and benefit from that in the long run.
Fantastic. Thanks for your advocacy on behalf of the Sparked program. That's what happens when you hand over your lunch money, isn't it? Jeanette, what about you? What does Sparked success look like?
Well, I guess I'm looking at utopia because it's going to take a little while to get to where my vision is around this, being able to have obviously the important nursing data being able to be included as part of the messaging for FHIR. It actually not only helps the patient because then they're not having to repeat the information that they've already provided. But what happens now, Brett, is often when a patient is transferred to another health service, there's a lot of phone calls that are done trying to follow up and get more information around the patient. And I'm hoping that with Sparked, it actually saves the nurses a lot of time and improves their efficiency in being able to have either the face-to-face or telehealth direct communication with the patient without having to go through and do that repetition. But I guess I would be most excited about the inclusion of having nursing and midwifery data. And certainly I've been an advocate for that in the Spark workshops that I've attended. And I know that there's a huge focus on chronic disease, and obviously that's a growing space. But it's nurses who are actually out there doing a lot of that work, managing those patients in chronic disease, either in their home or in the community. I just see this as being an enabler to be able to have better communication between health professionals, but also for the patients and their families.
Thank you. And Karen, you get the last word on your vision for Spark success.
I think adopting the Sparked outputs will be essential to leverage connected care. That's the most important thing. That's the thing that takes us the most time, looking for information. So making sure we've got consistent and timely access to data, and that will help us actually deliver better care to patients, to support patients, support their decision making.
Fantastic. Well, I think the audio was pretty good today. I know there's a cyclone bearing down on southeast Queensland, northern New South Wales, so hopefully that all sounded okay. If there were a few squawks in the background, not my children, but my sulphur-crested cockatoos in the backyard. That was a terrific chat. Thanks so much for your time.
The Sparked podcast is brought to you by the Australian Federal Department of Health and Aged Care, CSIRO's Australian eHealth Research Centre, HL7 Australia, and the Australian Digital Health Agency. You can join the community by heading to sparked.csiro.au. And don't forget to join us on LinkedIn at SparkedAU. This show is hosted by me, Brett Sutton, Director of Health and Biosecurity at CSIRO, and produced by Ed Studios' Janine Hamer and Lucy Ratz, and CSIRO's Dr. Naomi Stecklenburg. Sound by Hayley Dell.